Hello, my name is Hannah Polterman and I'm a paediatric speech and language therapist here in Clontarf Morgannwg. I'm based in Health Board's Children's Centre, so I work on over 3 bases within the Health Board.
My name is Mona Payne. I'm the Macmillan Clinical Lead Speech and Language Therapist based in the Royal Glamorgan Hospital. So I work with people who have had surgery or who are having treatment for head and neck cancer, and I help them to learn how to eat and drink and communicate more effectively after treatment.
I'm a paediatric speech and language therapist and I work with children who have additional needs, so from 0 to 19. So within the children's centres, I work with children with social communication difficulties such as autism, cerebral palsy, Down syndrome, and I also have a role within the special schools within the service as well, which also involves lots of working alongside teachers and other professionals such as dietitian, physiotherapy and occupational therapy.
So in my role, I work with people who have had head and neck cancer. So I work with adults and I support people from the point of their cancer diagnosis. So when they first find out they've got cancer, we help them to understand a little bit more about how that cancer is going to affect them, how their treatment's going to affect them, and then support them throughout their cancer journey really. So into patients who are living with and beyond cancer, so support them into survivorship, help them to get back to work, and all the things that are important to us really: communication, eating, drinking, getting back to living sort of full and active lives if possible.
When I come to the end of my journey in sixth form, I didn't know what I wanted to do, so I thought rather than jumping straight into university, I took a year out, and within that year I worked as a teaching assistant with children who had or have additional needs, and within that experience I had a lot of joint working with speech and language therapists, and it was just through that really, through discussion, through asking questions, I thought, yeah, I want to explore this a little bit further. So yeah, it's from that experience really I've ended up where I am today.
A little bit different. I kind of had my whole future mapped out. So at 13 I knew exactly what I wanted to do, and it was basically from, there used to be a TV programme called Jimmy's, I'm showing my age now, and I saw a speech and language therapist working with a child who had a cleft palate. Went downstairs and said to my mum, I decided what I want to do, I want to be a speech therapist. And my mum had never heard of speech therapy, but kind of said, oh, okay. And then yeah, chose my GCSEs, chose my A-levels, knew what I wanted to do. But my career path really changed because I had in my head, a bit like Hannah, wanted to work with children, wanted to work in a school, wanted to work with children with language impairment, and then started my course. And then in the second year, we started doing more adult orientated topics. Went out on my first adult placement, which happened to be a head and neck cancer placement, and yeah, the rest is history really. It kind of went from there.
I think the biggest thing I enjoy is the fact that each family I work with is very different. I work with children and families of all different backgrounds. I do very much like the role of working as part of a multidisciplinary team, so working with other professionals. I work with a great team of therapists, very passionate about their job, very hard-working, which does make the day-to-day work much easier and much more enjoyable. And it's just a rewarding job, you know. It's all about establishing in a functional means of communication for that child, which is detrimental.
Similar answer really, I suppose, even though we work in very different roles, there's a lot of similarity. So yeah, one of the things that I really enjoy about my role is I'm really embedded in the multidisciplinary team. So work with surgeons, work with oncologists, work with dietitians, clinical nurse specialists. So a really large group of people all supporting that one patient. And I think what I really love about my job is I get to meet people before they actually need us. So we get to build really nice relationships with them, and then, similar to Hannah, follow them through, get to know them really well, and get to know what's important to them. And I think that's the nice thing about a therapist. It's always about the patient, keeping the patient at the heart of what you do.
you would need a degree in speech and language therapy. I know it's recently changed, so prior it was a 4-year course, but it's now changed to a 3-year course.
Yeah. And there was only one place to do your degree in Wales, which was Cardiff, but now there's a new university course which is in Wrexham Island now. So there are 2 options if you want to study in Wales.
I think quite often speech and language therapy, lots of people think and feel it's just all about the speech, focusing on the speech. Whereas actually, you know, it's a massive spectrum from working with paediatric children to adults. I think what I would say, any advice I'd give anybody going into the course or into study the degree is just go in with an open mind, because you'll come across various different placements, various different experience, and like Menna mentioned, you might start off feeling that actually, yes, it's definitely paediatrics I want to go to, whereas actually it might turn into adults. So I think it's just keeping an open mind about that.
Yeah, I think if you're looking for a career that allows you to work sort of from birth to death and anywhere in between, I think speech and language therapy is a very sort of meaningful profession, isn't it? And I think in terms of supporting people to do the things that they want to be able to do, it's very sort of goal focused. And I think if you're a team player and you really want to make a difference, and perhaps you don't want to go down the medical route and you perhaps don't want to go down the nursing route, I think sort of an AHP career may be something for you to think about. And I think speech and language therapy gives you a real breadth of options, really.